Top 10 Most Dangerous Bacteria on Earth. Top 10 Most Dangerous Bacteria on Earth. Bacteria are disease-causing pathogens, and some of them cause deadly illness and disease in human beings. Each year millions of people die because of these microscopic living beings. The bacteria multiply in human bodies and take advantages of any weakness they find in your system. Here is the list of top 10 deadliest bacteria that can prove to be the most lethal of all. 10. E. coli. We are starting the list of most dangerous bacteria with E. coli, the most common bacteria found in human body. Infamous E. coli inhabits in the intestine of the healthy individuals. Some of their strains are detrimental to human beings, especially to very young or immune-compromised or elderly people. One of the rare strain of E. coli results in bleeding in the intestine. 9. Clostridium botulinum. Botulinum toxin attacks the nervous system of the affected individual and causes trouble in respiration, swallowing, speaking, vision, and causes overall physical weakness. This results in an inability to breathe, since the toxin causes paralysis in the breathing muscles and the person gradually dies. 8. Salmonella. This is a deadly strain of bacteria and affects in two forms, the enterica, and the typhi. The well-known typhoid fever is caused by Salmonella typhi. The last year alone it was responsible for 216,000 deaths. The contamination is spread through feces and urine of the infected person. Some people are asymptomatic carriers, for example, famous patient Mary, who was responsible for infecting 53 people and died in quarantine. She was the first asymptomatic carrier to be quarantined in the US. 7. Vibrio cholera. This is the bacteria responsible for well-known disease cholera. The disease is caused when humans take water infested with human feces. The incubation lasts about 1 to 7 days. The disease shows symptoms of chronic diarrhea, dehydration leading to much loss of water and salts. The loss should be made good. The vaccines are available but confer limited protection, and hygiene is the only solution to prevent it. 6. Tetanus. This is the very popular one. The good news is that there are vaccines available for it. For people who have not got the vaccine should get the vaccine in case if they get injured, and there are chances that dirt-carrying spores might have entered their system. The disease shows trouble symptoms such as lockjaw and terrible spasms. If any of these symptoms are observed, then the patient needs to be immediately shifted to ICU to increase the chances of recovery. In cities, it is no longer a problem due to awareness. Yet each year 58,000 babies die from it, and several adults either die or are disabled because of it. Many patients are paralyzed with curare in an effort to stop the bone-breaking spasms. 5. Aspergillus. It is also one of the common bacterial molds and causes pulmonary and blood infections. The infection can lead to death if not treated properly. It is common in cancer patients or the patients with other diseases. This bacterial mold is commonly found in air conditioning systems, and it is the place from where it spreads through the air ducts. Due to its huge population and frequency of infection, Aspergillus manages to get into the countdown of top 10 deadliest and dangerous bacteria in the world list. 4. Staphylococcus. Staphylococcus belongs to one of the largest bacterial group with over 40 subspecies and one of the most dangerous bacteria on Earth. It can easily be found on anyone's skin in a small amount. A normal immune system of our body is capable of handling it efficiently on its own. However, in the case where a normal immune system was not able to take care and the bacteria takes hold of someone, the antibiotics can be used. Many antibiotic-resistant strains have been observed called as MRSA, multi-drug resistant Staphylococcus aureus. These are well known for causing flesh-eating disease. It is assumed that this particular strain of bacteria has developed due to overusage of antibiotics and vancomycin. Maggot therapy has proved to be helpful in such cases by treating necrotizing fasciitis. In this therapy, the maggots eat away all the dead and gangrenous tissue, leaving behind health issues. However, in extreme case, maggot might not work and amputations or the removal of organs will be the only solution left to deal with the disease to safeguard the patient's life. 3. Syphilis. We are mentioning syphilis in this article since historically it was once the most debilitating diseases and was often called as the Great Imitator. The disease was very difficult to diagnose. In the disease, the genital sores would imitate other disease and would show symptoms those of other diseases. The disease can be easily treated now at the first and the second stage, yet tertiary stage is still a big issue. At this stage, the bacteria invade the brain, leading to generalized paresis. Syphilis can also affect the heart and its main aorta, which would lead to patient bobbing his head at the rhythm of the heartbeat. This often leads to death. This disease is very devastating. Looking at wrecks it creates. Syphilis is third in our list of deadliest bacteria on Earth. 2. Streptococcus. This is another notorious bacteria responsible for numerous cases of pneumonia found throughout the world. This killer bacteria is responsible for the cause of bacterial meningitis. Every human body has some amount of this flora in the respiratory system. However, the times when the immune system is compromised or something disrupted, these bacteria transform into virulent bacteria capable enough to kill those who are affected. Streptococcus is the second most dangerous bacteria in the world. 1. Tuberculosis. At the top of most dangerous bacteria, scientifically called as Mycobacterium tuberculosis, has ravaged the world for centuries. It has been found in the spines of the mummies. In the year 2007, there were 13.7 million chronic active cases, in which 9.3 million were new cases and 1.8 million resulted in deaths. According to WHO data, most of the cases are reported from developing countries. WHO has taken initiatives aiming at saving 14 million lives between 2006 to 2015. There have been no effective vaccines yet that can fully curb it. The disease can lie dormant for years in the respiratory system before being activated. Stay safe from these deadly and most dangerous bacteria. Have a good day.